Picture this. Every November, the grocery store quietly fills with tiny red berries. They sit there next to the turkey and stuffing mixes, like little glass marbles in a bag. Most of us walk past them. Maybe we buy one bag for cranberry sauce. And that's it. But these berries have a much bigger story. A story about your urinary tract, your gut, and even your heart. In this video, we're going to unpack what cranberries actually do in your body, how the science really looks behind the hype, and simple ways to use them now while they're in season. This is gentle educational information only, not medical advice. Always check with your healthcare provider about your own body and medications. Let's start with the basics. Cranberries are a true seasonal fruit. They're harvested once a year in early fall. And fresh berries usually show up in stores from around October to early January. That means if you're watching this now in the colder months, this is cranberry season in your kitchen. You'll see them in different forms. Fresh, frozen, dried, juices, powders, and capsules. The catch? The more processed they are, the more likely sugar sneaks in. Dried cranberries often come with a lot of added sugar. Cranberry cocktail or drink usually means sweeteners and flavorings, not just pure cranberry. So when we talk about health benefits in this video, I'm mostly talking about the berry itself, or lower sugar forms like whole berries, unsweetened juice, or concentrated products that are studied for urinary tract health. This is the part cranberries are famous for. You've probably heard someone say, "Drink cranberry juice for a UTI." Here's what's really going on. Cranberries are rich in special plant compounds called proanthocyanidins. We'll call them PACs to keep it friendly. These PACs seem to make it harder for certain bacteria to stick to the lining of the urinary tract. Less sticking means some bacteria are more likely to be washed out when you pee. So, in some people, especially women who get UTIs often, regular cranberry products can lower the risk of getting another infection. But, and this is important, cranberries do not replace antibiotics. If you already have UTI symptoms, burning, urgency, pain, you still need proper medical care. Think of cranberries like a gentle shield that may help reduce the chance of a repeat infection in some people. Not like a cure for an active infection. Soft reminder here. Everyone's body is different. What helps one person may not help another. Now zoom out from the bladder. When you eat cranberries as food, you're not just getting PACS. You're also getting fiber and other polyphenols, plant chemicals that your gut bacteria love to play with. Fiber feeds friendly microbes, and polyphenols are being studied for how they shape the microbiome, that whole ecosystem of bacteria in your digestive system. Some research even looks at cranberries and Helicobacter pylori, the bacteria linked with certain stomach ulcers. In some studies, cranberry juice rich in these compounds seems to help lower infection rates when used alongside medical care. Again, not a magic fix, but it suggests cranberries are doing more than just coloring your sauce red. You can picture them as a tart, fiber-rich food that quietly supports the terrain of your gut, not by doing everything alone, but by nudging your inner ecosystem in a gentler direction. Let's widen the lens one more time. Those same antioxidants and anti-inflammatory compounds in cranberries are also being studied for heart health. Some research suggests regular cranberry intake can support healthier levels of certain blood fats, help maintain normal blood pressure, and calm down low-grade inflammation. In people with type 2 diabetes, certain cranberry products, especially when they're not loaded with sugar, have shown small improvements in blood sugar markers in some studies. We're talking about gentle shifts, not miracle cures. There's even work looking at oral health. The same no-stick effect cranberries seem to have on bacteria in the bladder may also help stop some bacteria from clinging to teeth and gums. So, tiny red berry, but a surprisingly wide reach, urinary tract, gut, heart, mouth. Always within the bigger picture of your whole lifestyle, what you eat, how you move, how you sleep, and the care you receive from professionals. Now let's bring this into your kitchen. Fresh cranberries are naturally very tart, so most people cook or blend them with something a bit sweet, a bit bright, and a lot comforting. Here are a few gentle ideas. Stir a handful of fresh or thawed cranberries into warm oats with orange zest and a drizzle of maple. Make a chunky relish with cranberries, orange, ginger, and just enough sweetness from dates or a little maple syrup to take off the edge. Not drown it. Toss a spoonful of cranberries into salads with leafy greens, walnuts, and a simple vinaigrette. Use unsweetened cranberry juice as a base, then dilute it with sparkling water and lemon for a tart, refreshing drink instead of soda. With dried cranberries, you can treat them more like a garnish than a main ingredient. A small sprinkle in a salad or over yogurt. And when possible, choose reduced sugar versions. The idea is to keep the flavor and benefits without turning cranberries into candy. Cranberries sound amazing, but there are a few gentle warnings to keep in mind. Large amounts of cranberry products, especially juice, can cause stomach upset or diarrhea in some people. Cranberries may also interact with certain medications, especially blood thinners like warfarin. If you're on a blood thinner or have a medical condition, it's really important to talk with your doctor or pharmacist before adding concentrated cranberry products regularly. So, think of cranberries as a seasonal tool, not a prescription. They can support you as part of a balanced, mostly whole food diet, but they don't replace medical care. Soft wrap. As you walk through the store this season and you see those little bags of red berries, you'll know they're more than a one-day sauce. They're tiny red shields for your urinary tract, your gut, your heart, and maybe even your smile. If you'd like more gentle, nature-based rituals like this, you can explore my Detox and Rituals playlist and subscribe so we can keep walking through the seasons together.